Hey everyone, this is Daily Dose of Medicine, and in today's video, we'll talk about side effects of testosterone replacement therapy. The Endocrine Society defines the lower limit of normal testosterone in healthy, non-obese young men approximately 264 when measured by a CDC certified assay and recommends confirming low levels with two separate morning fasting measurements in the appropriate clinical context. The side effects of testosterone replacement therapy include both common and potentially serious adverse effects. According to Endocrine Society clinical practice guideline, the most frequent side effects are erythrocytosis, which is elevated hematocrit and hemoglobin, acne, oily skin, and breast tenderness. Other recognized risks include gynecomastia, testicular atrophy, infertility, fluid retention and edema, worsening of benign prostatic hyperplasia, increased blood pressure, and sleep apnea. And it can also cause increased PSA levels and may rarely be associated with prostate events. However, current evidence does not show an increased risk of prostate cancer with appropriate monitoring. Skin reactions, especially with transdermal preparations, application site irritation, and hair loss are also reported. Mood changes, depression, and anxiety have been observed, and there is risk of decreased HDL cholesterol. Serious but less common risks include venous thromboembolism, myocardial infarction, and stroke, particularly in patients with pre-existing cardiovascular risk factors. The American College of Physicians and the Endocrine Society both recommend regular monitoring for these adverse effects during the therapy. In summary, testosterone replacement therapy is associated with a range of side effects, most notably erythrocytosis, acne, gynecomastia, testicular atrophy, infertility, fluid retention, worsening BPH, increased PSA, mood changes, and potential cardiovascular events. Regular monitoring is essential to mitigate these risks. Thank you so much for watching. Don't forget to join our channel membership, watch our other videos on testosterone, and I'll see you on the